Well, welcome to our Academic Health Department webinar, Envisioning and Building the Public Health Workforce of the Future, the Critical Role of Partnerships. I'm Ron Bialik, President and CEO of the Public Health Foundation, and we are delighted that you have joined us today. We have an exciting lineup of speakers and are looking forward to engaging all of you in a discussion about partnerships, in particular, health department and academic partnerships that are needed and are helping to reinforce the building of our public health workforce. First, I'd like to start off with a few housekeeping items. All participants in today's webinar are muted, but we're looking forward to hearing from you. Throughout the presentations, please add your comments and questions to the chat box. After the presentations, we should have time for discussion and Q&A, and we will address as many of the questions as possible at that time. We'll put a link to the slides for today's presentation in the chat box if you'd like to have a copy. And also, we're recording today's session and we'll be making the archive available to all of you. Today's webinar is presented by the Council on Linkages between Academia and Public Health Practice and the Public Health Foundation. We particularly thank the Centers for Disease Control and Prevention, Center for State, Tribal, Local, and Territorial Support for funding activities of the Council on Linkages. Council on Linkages, for any of you who may not be familiar with the group, is a consensus-driven collaborative of 24 national organizations engaged in public health that works on initiatives designed to benefit the workforce and is staffed by the Public Health Foundation. The Council on Linkages has been around since 1992 and aims to improve the performance of individuals and organizations within public health by fostering collaboration between academia, public health practice, and healthcare, promoting ongoing education and training, and strengthening public health infrastructure. Members of the Council on Linkages span a variety of national organizations in public health and population health. The Council on Linkages currently is focused on two major initiatives: the core competencies for public health professionals, and I suspect a number of you out there today have participated in some of those webinars, as well as the town halls, and the academic health department learning community. Today, we are focusing on partnerships, in particular, academic practice partnerships. The Council on Linkages established the academic health department learning community to help support organizations working to develop and sustain AHD partnerships, providing an opportunity for people to explore the idea of AHD partnerships and learn from each other. The learning community has been around since 2011, is open to anyone who's interested, and currently has around 1,100 members. The learning community offers a way for people to connect with others who are engaged in this work, as well as provides tools, resources, training, and technical assistance to organizations working to establish and grow AHD partnerships. All of the AHD learning community's resources are freely available to anyone who'd like to use them. Our speakers today have a wide variety of experiences in public health practice and academia, developing, nurturing, and expanding successful partnerships that truly have an impact on building capacity of both practice and academic institutions. Most importantly, these partnerships also have positive impact on delivering essential public health services. First, we have Kathleen Amos, who is with me at the Public Health Foundation and directs our academic practice linkages unit. Kathleen is responsible for creating and nurturing the academic health department learning community. And I'll be sharing with us today some background about the academic health departments and what they are, and highlight examples of how these partnerships are supporting community capacity in responding to the COVID-19 pandemic. Kathleen will be followed by 4 other speakers who'll be sharing their experiences establishing, promoting, nurturing, and expanding academic health department partnerships. We have Antanya Blinn and Tali Schiller joining us from Massachusetts. Antanya is the Director of Performance Management and Quality Improvement in the Massachusetts Department of Public Health. She established and leads the agency's academic health department, where she facilitates practice-based collaboration, research and evaluation, and professional development with academia. Tali is the new program manager of the Massachusetts Academic Public Health Corps, very unique corps that we'll learn more about shortly. In this role, Tali is supporting Massachusetts' local public health capacity and diverse public health workforce of tomorrow. Following Antonia and Tali, we have Dr. Paul Irwin, who is Dean of the School of Public Health at the University of Alabama at Birmingham. In addition to being one of the few researchers who's looking at academic health departments, Dr. Irwin was director of the East Tennessee Regional Health Office and head of the University of Tennessee Knoxville Department of Public Health, where he established a vibrant academic health department partnership. And finally, we have Dr. Judy Monroe, President and CEO of the Cdc Foundation, where she leads efforts of the foundation to protect and promote health in the United States and around the world. Dr. Monroe has extensive experience in public health practice, healthcare, and academia, having served as a family medicine, director of a family medicine residency program, state health commissioner for Indiana, and deputy director of the Centers for Disease Control and Prevention Office of State, Tribal, Local, and Territorial Support. Dr. Monroe has established, worked with, and expanded partnerships throughout her career, work that she continues today in her role as the CDC Foundation CEO and president. Before we dive into today's presentation, we'd love to know a little bit about who's with us. And so we have a little poll, and hopefully the poll will be coming up shortly. And this poll asks you where you come from. And if you'll please answer that, and if you don't have the ability to use the poll, please put the information in the chat box. And if you answer other, please feel free to answer an other. So give a moment for people to respond. Just about done. Very good. I'm going to close the poll now. And so as you can see, we have the majority of you from local health departments, but also a fair number from state health departments, as well as academic institutions and other agencies and nonprofit organizations. We are delighted that you're with us today. And I'm not sure if I shut that off, but I think I have. Okay, Kathleen, I'm going to turn this over to you now.
Fantastic. Thank you so much. As Ron mentioned, my name is Kathleen Amos, and I'm here today to start us off with a little bit of an overview of what an AHD partnership is and how they might be useful. So to get all of that discussion started, we'd like to begin with a quick definition. Throughout today's webinar, we'll be talking about partnerships that have been built between health departments and academic institutions, or what we call academic health department partnerships. These partnerships can take a wide variety of forms, but at their core, they are all collaborative, mutually beneficial relationships that serve to strengthen and formalize collaboration. So kind of to move the relationship between organizations beyond working together sort of sporadically because two individuals happen to like each other to more regular part of how the organizations operate. These partnerships can enhance public health education and training, research and service, strengthening both the current capacity and workforce of the organizations as involved, as well as building for the future. AHD partnerships can look quite different from one community to the next, and there's no sort of one right way to develop this type of partnership. But with that said, there are some basic characteristics that the Council on Linkages often talks about as being part of an AHD partnership. So at the most basic level, an AHD partnership has at least one academic institution and one health department working together. Hence the name, Academic Health Department Partnership. As part of working together, there may be some type of written agreement linking the organizations. So a contract, a memorandum of understanding, a memorandum of agreement, or something like that. And through the partnerships, the organizations may engage collaboratively in providing education and training to students in the current workforce, work together on joint research projects, or jointly provide public health services. And these partnerships can also include sharing personnel, funding, or other resources between the organizations. So with that brief overview, we do have one more quick poll because we're curious to hear a little bit about your experience with AHD partnerships. So if we can launch that now, we'd love to get a sense of where you are. And again, if that poll is not working for whatever reason, feel free to drop us a note in the chat box. Great, so we'll give people just a little bit to fill that out. Awesome. A few more seconds. Oh, and someone put in the chat box, just learning about it for the first time today. Perfect. So we can close that poll maybe and share the results with all of you. So it looks like a lot of people are just learning about it, not yet, but kind of working on it. And then we have quite a number of people who are engaged actively in AHD partnerships right now. Awesome. So it's great to see how many people are involved in AHD partnerships. And for those of you who aren't yet, you've come to the right place to learn a little bit more about it. We do know that collaboration and partnerships between academic and practice organizations are widespread based on data that's available from the National Association of County and City Health Officials and the Association of State and Territorial Health Officials. These data show that the majority of local and state health departments work with academic institutions in some way. So it looks like about 88% of local health departments do so, with 62% having regular meetings, written agreements, or sharing personnel or resources, some of those things that we tend to associate with having a more formal partnership. Similarly, 100% of state health departments work on projects with academic institutions. So why might you want to do this? Obviously, any type of partnership, requires time and resources. So there really do need to be benefits for both organizations that make that worth it. AHD partnerships can strengthen the connections between public health practice and academia, enhance capacity of the organizations involved, and further the pipeline into governmental public health. It's really important that these partnerships, as they're set up, are mutually beneficial, that every organization shares in the benefits. And we've just listed a handful of benefits that come up often when we talk about AHD partnerships on the slide here. So these partnerships can help enhance capacity to better address community health needs, better prepare students for careers within health departments, because many of these partnerships involve student training, help in the recruitment of personnel, particularly again, as we talk about that pipeline from academia into governmental public health, facilitate lifelong learning, both for practitioners and faculty members, develop and use research that is relevant to practice, because these partnerships often bring academic researchers closer to the practice environment, tend to emphasize more community-based research activities, maximize the use of limited resources, as well as enhance competitiveness for new resources, help in meeting accreditation standards, both for health departments and for academic institutions. And ultimately, obviously, these are all pieces of a larger picture, and we hope they all serve to help strengthen the public health system and improve the public's health. And I think we've seen some really concrete benefits of partnerships between health departments and academic institutions play out across the country over the past couple of years as we've been responding to COVID-19. And I just want to take you kind of on a whirlwind tour through those, and then we'll dive deeper into a couple as we go through the webinar today. So for example, early on in the pandemic in March of 2020, when health officials in Florida were overwhelmed by the spread of the virus, the state health department reached out to 5 universities and recruited 100 professors and students to help them do contact tracing and learn more about the spread of COVID-19. Also in March of 2020, 6 employees of the Toledo-Lucas County Health Department in Ohio, who were key to its pandemic response plan, tested positive for COVID. And the staff who were in contact with them, including the county's health commissioner, went into quarantine. As the health department kind of scrambled to address this gap, they reached out for help, including to the University of Toledo, which sent graduate students from its public health program to help fill in the needs. COVID also led Bowling Green State University near Toledo to hire its first chief health officer, who, among other activities, was charged with building out a newly formed public-public partnership with the local county health department, Wood County Health Department. Their partnership agreement calls for collaboration on pandemic planning, research, community outreach, grant writing, program evaluation, and public health projects. And they're also exploring sharing workspace and staff. Students from the Melanenid Zuckerman College of Public Health, or MESCOV, at the University of Arizona collaborated with county health departments in rural areas of the state to support the COVID response through helping to implement contact tracing programs, developing graphics and other materials for education, conducting literature reviews, designing communication materials, and developing webinars. And MESCOV students are also supporting larger counties like Pima County and others with infographics that they have designed and collected in an online library, making them available and free for anyone to use. Miami University and Butler County General Health District in Ohio developed an innovative disease investigation and contact tracing program, which added 108 contact tracers to the county's public health workforce and enhanced technology for managing cases and contacts. And the New River Academic Health Department in Virginia has facilitated a number of activities to help the health district with COVID response, including organizing Medical Reserve Corps trained public health students, faculty, and staff to volunteer for a call center to answer COVID questions from local residents, as well as students to volunteer at testing sites. By June of 2021, the University of Nevada, Las Vegas and Southern Nevada Health District Partnership employed nearly 240 student contact tracers who spoke 29 languages, with the team investigating more than 38,000 cases, fully 1 in 6 of all COVID case investigations in Southern Nevada up to that point. The AHD consortium at the Massachusetts Department of Public Health mobilized to support local boards of health in responding to the pandemic, which you will hear more about next. And the University of Alabama at Birmingham School of Public Health students are supporting the Alabama Department of Health with contact tracing, among other activities, which you'll also hear more about today. So I know that was really quick, but with that, I'd like to stop and turn the floor over to Antanya and Telly to tell you more about what they've been able to accomplish through their AHD partnership. Thank you so much.
Thank you so much, Kathleen. I think someone needs to spotlight me. So I'd love to share along with my colleague Tali about the Massachusetts response to address COVID-19. So if we go to the next slide, just share a little bit of background about the Massachusetts Department of Public Health. We have just over 7 million residents, and we are considered a decentralized public health system and have no county-based system. We have 351 cities and towns, and we have almost that many local boards of health. We also, within our purview of public health in Massachusetts, oversee 4 public health hospitals and also provide contracts for services with coalitions, over 700 of those, as well as licensed individuals, facilities, and industries, more than 200,000 of those licenses. Next slide, please. When we had a new commissioner come on board in 2015, she was very dedicated to academic partnerships. And so a group got together to form a better understanding of how academic partnerships were playing out across the department. So in 2016, we met with staff from across the department and identified 2 main ways that academic partnerships were playing out in the department. First was through research and evaluation methods. So there was the example of vendors. So actually providing an opportunity for academic partners to reply or provide a response for a quote for services or an RFR, some might know it. We also worked with academic partners to do some really cool work, which I'll talk about in just a moment in those joint ventures. We also had the opportunity for academia to advise us, and then likewise, based on how it really plays out in the Department of Public Health, advising our colleagues at the academic partners. And from workforce development, there were 3 key areas where we found academic partnerships. Internships, they were very informal at the time. Workforce training, both our staff, and that was formalized, as well as our local public health workforce. And then we also found that we had staff who also had joint appointments at academia. So some really great things for us to learn as we became very interested in becoming an academic health department. Next slide, please. So I want to share a little bit about how some of these academic partnerships have played out. So I'm sure it's not new to anyone to have conferences and professional development opportunities with academia. Another really cool thing that just emerged actually during the pandemic was the opportunity to be a preferred partner with 2 of our academic partners. And this allows our staff to have reduced amounts to participate in professional development, which is really awesome. We also have had some incredible partnerships with our medical schools. There are 4 in our state, and they together developed the medical education core competencies for prevention and management of prescription drug misuse. My understanding was at the time this was the first in the nation, and now there are others across the country. Next slide, please. Another one of our academic partnerships was one of those vendor opportunities where we had the opportunity to request a quote for services to provide the Massachusetts Screening, Brief Intervention, and Referral to Treatment, which we affectionately call MASPIRT. And we were able to partner with Boston University and Boston Medical Center to implement the program in 3 medical centers and 5 community health centers. Since then, there's been hundreds of thousands, and I actually wish I could say, I think I might be able to say hundreds of thousands of screenings that have happened. And as a result, there is a more formalized program also in all of our public schools. Next slide, please. So you may have remembered in the slide I shared with our different types of models of academic partnerships. One of them was specifically in that first column, research and evaluation. And when this model was first developed, the Massachusetts Public Health Data Warehouse, it was originally called Chapter 55. Because that was how we were able to do this, I'll call it a use case opportunity. There was a tremendous, and there still is a tremendous opioid epidemic in Massachusetts, and we only have access to the data that we have access to, right? So this provided the opportunity through a legislative body to create the opportunity to pull multiple entities of data into one working database to do research and evaluation. So we use this first opportunity specifically around responding to the opioid epidemic as a very successful way to understand what programming we should focus on, which specific populations are at highest risk, to be able to be most effective in our public health endeavors. And this has really emerged to be incredibly important. And it was seen so much that it became the Massachusetts Public Health Data Warehouse, where it's not just about a study to understand and respond to the opioid epidemic, but to other areas of public health as well. And you'll notice in each of these slides, you can go to the next slide, I've provided links that you can check these out more specifically if you want to see some of those details. And then the last academic partnership I'm going to highlight here is our local Public Health Institute of Massachusetts, which is through Boston University. We have been working with them for a very, very long time. This specific partnership has been since 2010, and we have faculty and staff who are actively partnering with local public health to really build and develop materials, education, seminars, as well as a career ladder, if you will, of training modules and materials to really support local public health. So it's a really great long-term endeavor, and I'm sure this will continue for many years into the future. So with the next slide, I'll just share with you that in 2019, we formally started our academic health department with 8 schools and programs of public health. You can see those schools listed to the right. And we really wanted to focus on strengthening our relationships around workforce development, professional support, field placement, research and evaluation, and interorganizational systems communication. And so we were very excited when the COVID Command Center, who was overseeing all aspects of COVID for our state, said that they wanted to work with public health deans across the state. And so we very quickly, within 48 hours, pulled together this academic health department group. Plus, we were able to also connect with 2 of the community health worker training programs, one of which resides in a community college. And we also, while we were at it, wanted to get as many of our public health undergraduate programs included as well. So it ended up being 13 academic partners coming to the table in response to a request to better support local public health. And that was the development of our very first program within the academic health department, the Academic Public Health Corps. So I'll now pass it along to Tali to tell you more.
Thank you, Antonia. Next slide, please. Good afternoon, everybody. I'm very happy to be here today to tell you a little bit more about the Academic Public Health Corps. Like Antonia said, it is the first program of the Academic Health Department partnership in Massachusetts. And it is a program that was created at the very beginning of the pandemic with an eye towards supporting our local public health professionals who all of a sudden had a lot of contact tracing on their plates. So the AHD looked towards a great natural resource in the state of Massachusetts, which is our public health students. And they said, on the one hand, we have these public health students that are available and looking for experience. And on the other hand, we have this massively decentralized local public health system that is going to need a lot of help through this COVID pandemic. And by linking those two groups together, we can each help each other. So the purpose of the Academic Public Health Corps is to connect local health departments in Massachusetts with public health students looking for experiential learning opportunities. And these have expanded past COVID only in the last couple of years. It started out as COVID, but now it's all sorts of local public health activities. Next slide, please.
So with equity being at the center of the Academic Health Department and the Academic Public Health Corps, it really started with the development of value statements. And so the Academic Health Department had an original statement for racial equity. We lead with a racial equity lens and an intersectional analysis that acknowledges the history of structural racism and other forms of oppression. And so we asked our academic partners, as well as the public health students and alumni who were participating in the Academic Public Health Corps, to help us with the formation of a racial equity why statement. So we shared examples of data in our specific communities and overlaid some very specific examples of historical racism as a way of helping to really bring to life the reality of where folks were going to school in Massachusetts and the long-term effects of racism. So we asked the students to assist us. We used Jamboard, which if you've never used it, I highly recommend it, to be able to do that brainstorming. It is more anonymous because you're either an important elephant or an iguana. So folks can participate without really being specifically individually identified, which is really nice to create a collaborative environment. So the result of this work you see here, which is the statement. So you can notice there's two sections. One is what the AHD, the Academic Health Department, will do, and what our call to action is. So I do just want to read the one statement that really prefaces all of this. So forgive me for not looking at you all. So the Academic Health Department and the Academic Public Health Corps values diversity, cultural humility, and ethical decision-making. Racism is embodied in unjust and unfair policies and practices that manifest as inequitable and unacceptable health outcomes. We understand that racial equity is an integral part of and a major driving force for health inequities. No real progress towards health equity can be made without first addressing structural and institutional racism in every aspect of public health and centering the voices of lived experience of Black, Indigenous, and people of color. Next slide, please.
So for 2 years, the Academic Public Health Corps was a volunteer corps. So during the real crisis points of COVID, when this was all getting pulled together, it was getting pulled together with little to no funding. It was just a matter of, you have the need and you need to, help the people that are out there in the field. And I'm very happy to say that as of July 2021, this is a funded program. It's been funded by the Massachusetts Department of Public Health. And that means that we are now be able to pay our core members a stipend, which is just an incredible step to take towards sustainability. So core members are paid. They're paid a $2,400 stipend for completing 160 hours of local public health related projects. The positions are short-term and flexible. So students who get hired as core members, they can work anywhere between 5 to 15 hours a week, depending on their schedules and their availability and other commitments. And then that 160 hours can take, from 2 to 7 months, depending on how many hours they decide to work per week. The students, this is also meant to be a professional development opportunity for them. So not only are they completing these projects, it's also, it's a paid internship functionally. So we're also asking them to complete 5 or more hours of professional development trainings. And that will include some requirements like introduction to local public health, project management, health equity, and it will also include some electives that they choose for their own personal professional development goals. Next slide. So core members currently work on a wide variety of projects, pretty much as wide as the variety of things that local public health works on, they also work on. So some projects that we've gotten sent to us from local health departments that core members have worked on is all sorts of health communications, working on social media, creating mask signage for local businesses. They've worked on community outreach. They've done a lot of wellness calls, COVID-19 test results calls. Of course, the contact tracing was huge in the beginning. They've done translations. They've done data analysis and presentations. Made a lot of interesting maps in GIS, looking at, for example, where there's a higher rate of vaccination and where there's lower rate of vaccination, so that you can place the vaccination clinics in those areas of lower rates. They've worked with community-based organizations. They've worked with mobilizing, supporting partnerships, and much, much, much more. Next slide. So this is an ongoing program. Like I said, we just got funded and we're so excited to continue building and growing this academic public health core for the benefit of local public health and for public health students in Massachusetts. A couple points on its impact so far. Since its inception in March 2020, we have deployed over 910 students to support public health across Mass, and they have served over 21,000 hours in over 138 communities. All local boards of health that were surveyed rated having a core member as very helpful. And like I said, core members have assisted local health with a wide variety of vital projects, including contact tracing, community outreach, health communications, and much, much more. Next slide.
So we found that this work is very important to sustain. And so with the development of our first program, the Academic Public Health Core, we were able to find that funding that enabled us to contract with a vendor to manage the first program of the Academic Health Department. Our goal is to continue doing that and to find other opportunities to continue to grow that, as well as other programming within the Academic Health Department. We also were able to establish through the legislative budgeting process an Academic Health Department Trust Fund. This is a fund where it sounds crazy to say this out loud, but we didn't have a mechanism to actually accept funds from our academic partners. And so this now is a dedicated space that is not subject to annual appropriation. So any funds that are provided to us through our academic partners can go into this to continue to support academic health departments and ongoing support for things like paid internships. And as we continue to find those other grant opportunities, there are a number of workforce development opportunities. So right now we are going to be embarking on an environmental scan of what's happening with internships and at the Department of Public Health these days. We understood how academic partnerships were happening, but we didn't do that inventory of all the different fellowships, internships, direct relationships that our staff have with academia, and we really want to better understand that. We also want to understand the needs of our colleagues within the state health department. We want to make sure we create a robust pipeline for local and for state public health. So we'll continue to collaborate with the Academic Public Health Corps. And we also are partnering with UMass Lowell, who was one of the several recipients of the Public Health Informatics and Technology Workforce Development Program. We're also building upon the Commission of Local Public Health's blueprint recommendations. If you all have not seen these recommendations, I highly encourage you to check out the document. Make sure that we post that throughout the time that we have together, so you'll have that link. And also, our huge partner in this work, especially with the development of the Academic Public Health Corps, has been our Office of Local and Regional Health. We're very excited that just in the last fiscal year, we actually have 2 dedicated staff members to workforce development for local public health, and are really thrilled to continue the relationship and partnership. So with that, the next couple of slides for you are just contact information if you want to follow the Academic Public Health Corps. They're all on social media. I encourage you to go like them, follow them, retweet, repost, favor, whatever you need to do to help us get the word out about the Corps. They really developed some amazing communications tool that you all can just tap into if you'd like to. And then the next slide is for the Department of Public Health and our resources to connect with. So with that said, I am very excited to transition to our next speaker, which is Dr. Paul Irwin of the University of Alabama at Birmingham. Dr. Irwin, please take it away.
And Tanya, thank you very much. Fantastic work that you and Tally have been describing in Massachusetts. Just really kudos to all of the great work that's going on there. So next slide, please. Again, I'm Paul Irwin. I'm here at the School of Public Health at the University of Alabama at Birmingham, UAB. We're the only accredited school in the state. And the health department partnerships that I'm going to describe here include our county health department here serving the city of Birmingham, Jefferson County Department of Health, our Alabama Department of Public Health, and then the Mobile County Health Department as well. Next slide. Our state has a mixed governance structure in terms of health departments. 2 of the counties, Jefferson County and Mobile, are semi-autonomous and are both report to a county board of health. The other 65 counties in the state are grouped into health districts, and all of those report up through to the Alabama Department of Public Health. There's a county health department in every county except for 1 of the 67. Next slide. What I'm going to first describe for you are activities that we have had ongoing here locally with the Jefferson County Department of Health. This rests on a long-standing set of relationships as the academic health department here in Birmingham that certainly predated my arrival here as dean about 3.5 years ago. Most recently, pre-COVID, that partnership was focused on implementing another iteration of MAP, Mobilizing for Action Through Planning and Partnerships. We're very close geographically. The health department is just 2 blocks from the school, makes it convenient to actually get together with people when we can do that. Our previous directors include people with really notable histories in the annals of local health department directors, including George Hardy, Bill Roper, who went on to, of course, direct the CDC, and Carol Samuelson. Our current director of the Jefferson County Department of Health is Dr. Mark Wilson, who was previously chief of staff at the Cooper Green Hospital, which is a public hospital that provides service especially to low-income and underinsured persons. Next slide. Our work with the Jefferson County Department of Health vis-a-vis COVID began just a month into the pandemic in early February, where we convened a panel of experts from both UAB and the health department to do an early take on COVID-19. In March, shortly after the first case in Alabama was reported, Mark Wilson, as the county health officer, convened local health experts, including several of us here from the School of Public Health, to do an early discussion on issuing a first set of orders, including social distancing orders. The Jefferson County Department of Health immediately began recruiting students from the school to serve in internship capacities for surge capacity. And then in April, really not long after we entered into the sort of the shutdown period, Mark Wilson and I both participated on a panel with others to draft recommendations to our local congressperson to reopen the state, if you will. We've been involved in both sides of the academic partnership in forecasting the epidemic. Very early on, health department staff provided training in a classroom setting to a number of our students on case investigation, contact tracing, and also were involved in classroom lectures as well. Next slide, please. What I'll describe for you next is a set of partnership activities with the Alabama Department of Public Health, which includes a number of different activities over the course of the last 2 years. Next slide, please. The first is our case investigation contact tracing work. We've been one of the major contact tracers for the state health department. At any one time, we've had as many as 80 students or 80 contact tracers, most of them being students, and not all public health students, School of Nursing, School of Medicine, College of Arts and Sciences. And you can get a sense for the thousands of case interactions that they have had. And it's been a fantastic experience for the students, taking what they're learning in the classroom and immediately applying it to a very real world problem. Next slide. So over the course of this time, investigating something on the order of 45,000 cases completed, sending out thousands and thousands of letters and contacts traced as well. Next slide, please. Bianca Godwins is one of our major School of Medicine student managers in our case investigation contact tracing work, and we anticipate that that it could very well be that one day Bianca will manage the world. Next slide. The second activity is to describe the Apple-Google contact tracing work that we were doing with the Alabama Department of Public Health. Next slide. So each state had one contract with Apple-Google to establish a contact tracing app. The Alabama Department of Public Health asked us at UAB to do this. This is involved others across the university, not just the School of Public Health. A contact tracing app that has to date been downloaded over 350,000 separate times with over 2,000 verified tests entered into the contact tracing app, which then immediately notifies people if the phones have been in close proximity that would indicate an exposure to COVID. Next slide, please. The next activity is to describe the launching of the Alabama Regional Center for Infection Prevention and Control. Next slide. This was funded through the Alabama Department of Public Health, but is CDC epidemiology and laboratory capacity funding through their cooperative agreement. And it allowed us to stand up a regional center for infection prevention and control, where we provide consultation and support services to entities across the state, ranging from FQHCs to nursing homes to hospitals to other places of care, to enhance capacity for infection control and to build infection prevention and control and outbreak response capacity and expertise as well. Next slide. We have listed here a number of resources that are available, a whole slew of training activities that have been provided through the Regional Center for Infection Prevention and Control. And you can get a sense of these by going to these websites. Next slide, please. Next, I'd like to describe the K-12 screening testing that we've been doing under the auspices of the Alabama Department of Public Health. Next slide. Again, this was funding that came from the CDC back in the early spring of 2021, and the Alabama Department of Public Health asked the School of Public Health to manage and oversee this statewide project, which is the largest contract in the history of the school. This involves providing or offering voluntary COVID screening testing for all K-12 public and private schools in the state. Next slide, please. So again, the purpose is to offer free screening testing to not only students, but to faculty and staff to help maintain in-person learning. Next slide. You can see that as of the end of January, our team has very quickly stood up quite a large system of COVID screening testing across the state, with outreach actually going to over 1,400 schools and 188 systems with a population of over 600,000 people. You can see the numbers here where we're testing on the order of 3,500 students per week now, with 2% positivity. But again, those positives allow us to provide recommendations for quarantining and isolation that the schools wouldn't otherwise have had access to. Next slide, please. You can see here the rate of uptake across the schools, which was propelled significantly by the Omicron variant when it hit in December here. Next slide, please. Finally, to circle back to some additional infection prevention and control expertise that the Alabama Department of Public Health has asked us to oversee. Next slide. And that's an expansion of the work that we're doing with the Regional Center for Infection Prevention and Control to assist nursing homes and long-term care facilities to support their ability to respond to COVID-19 and to assist with building and maintaining infection prevention infrastructure in these long-term care facilities across the state. Again, this is additional CDC funding through the state health department and the state asking the School of Public Health to oversee this work. Next slide, please. We've had a number of additional public health UAB partnership activities continue throughout the time period of COVID. Almost every week, a COVID roundtable discussion involving people not only from the school, but from the Jefferson County Department of Health as well. almost on a weekly basis as well. We're on a call with leadership at the Jefferson County Department of Health, with the state health officer, Dr. Scott Harris, with the health officer from the Mobile County Department of Health, Children's Hospital of Alabama, an infectious disease specialist here at UAB as well. Again, that weekly opportunity to convene and to talk about issues of concern from both a practice and academic perspective. In the fall semester, in coursework, we had Dr. Wilson in the classroom a couple of times describing the early work of COVID from his perspective. And that, I'm delighted to say, is now a case study that has recently been accepted for publication. And then in the fall, we convened a panel from these health departments to talk about careers in public health, particularly inviting current medical students and students who are in our dual degree MD MPH program to get them interested in and curious about careers in public health. Next slide, please. Well, I think that's it for my part. I want to again thank you all for taking the time to participate in this webinar, and I'm honored to hand it over now to Dr. Judy Monroe, the President and CEO of the CDC Foundation. Dr. Monroe.
Thank you. Great to join all of you, and I want to thank the Public Health Foundation for having me to be able to join you all. The value of partnerships during COVID-19 during the response has been just critical in strengthening health departments, in my opinion, and to look forward to that strengthening of the public health workforce in the future. I will tell you that being with the CDC Foundation, we're a bit of a different animal in the ecosystem, and so we partnered through a cooperative agreement with CDC and actually through some private funding, and we hired during COVID over 3,200 surge staff, their CDC Foundation field staff that are working in health departments across the country, literally in every state health department, large city health departments, as well as some of the smaller health departments. And so if we go to the next slide, I wanted to begin. My journey in public health started in Indiana. So I was a state health officer, as you heard in my introduction, by Ron. And when I was health officer in Indiana, we had the opportunity to work with a number of universities across the states. Those universities are listed on this slide. But I wanted to call out and give you a bit of a journey, a notable partnership that started when I was a health officer between the Indiana University and the State Health Department, and then led to a relationship with the Richard M. Fairbanks Foundation. So coming to speak to you today from a foundation, I've got to bring philanthropy into the conversation when it comes to partnerships. This relationship that we had ultimately led to the creation of the Indiana University Fairbanks School of Public Health at IUPUI. And then fast forward to COVID, the IU Fairbanks School of Public Health at IUPUI hired, trained, and managed contact tracers to track the spread of COVID-19 in Indianapolis in collaboration with the mayor and with Dr. Virginia Kane, the health director at the Marion County Health Department, similar to the other contact tracing stories that you've heard by the prior speakers. And in doing this, the School of Public Health was able to partner with the health department to expand the contact tracing throughout the state. The IU Fairbanks School of Public Health also worked really closely with the Indiana Department of Health on a collaborative study on COVID-19. And they played Indiana, as a result, was able to play a real leadership role in ways to help accurately determine the population prevalence of SARS-CoV-2 in this collaborative work, which really demonstrated how research and practice can go hand in hand. But to fast forward even further, thinking about the future of the public health workforce, the Fairbanks School of Public Health at the conclusion of, I think it was December of 2020, put out a report on the Indiana public health system. They did a deep dive looking at the system, and that helped spearhead and lead to the governor of Indiana, by executive order, doing a governor's public health commission, which I've been invited to co-chair along with a former 25-year veteran of the state Senate. And we're looking to modernize public health, which of course includes the workforce. And there's a lot of discussion about workforce and the workforce needs in Indiana in the report from the School of Public Health. So as public health, we've just come to appreciate, the important role that so many fields and sectors play in the work of public health. So it really is, there's a real need to expand the vision of what the qualifications are needed as we go forward with public health, and to diversify the public health workforce in really meaningful ways. So as an example, thinking about paid internships, which mentioned earlier on the webinar about being able to pay folks that are in internships, apprenticeships, loan forgiveness, tuition reimbursement, those types of things are all topics that the commission is taking on as we talk about things. If we go to the next slide, I wanted to talk a bit about our work at the CDC Foundation. As we got into COVID over the last 2 years, we also at the foundation worked with a number of universities. This is just a sample of the universities we worked with on this slide. But I wanted to call out particularly the University of Washington, because it tells a really nice story of this the academic health department working with the universities. If you all remember, Seattle was the first major city to be hit really hard with COVID. And the University of Washington at that time had 100 graduate nursing students and almost 60 undergraduate nursing students that were in their last quarter of nursing school. And here we were as a country that needed nurses desperately. They only had a few months left to graduate, but the requirement that was left for these students were their clinicals. They needed to be in clinics, training, hands-on, or otherwise they were unable to graduate. And so this was not a time in this emergency crisis to not have them graduate, but it also put a big burden to be able, while everyone on the wards was trying to manage the pandemic, to be able to train the students. So a really unique partnership was born with the School of Nursing team, set up this partnership with the Public Health Seattle and King County Health Department with some financial support from the CDC Foundation. And the nursing students were able to receive the needed training by supporting the Public Health Department during the COVID-19 response, which of course they needed immediate staff for their bandwidth during the crisis. And the first need was the call center, the COVID-19 call center, which the nursing students were able to help with, which was great. But they also, the team was able to coordinate the deployment of nursing students to clinical sites to provide direct patient care in hospitals and clinics. But they needed resources like personal protective equipment, which they were able to do. And they had to be able to staff the clinical settings because, again, the folks that were there in these clinical settings just didn't have time. And so they actually deployed their faculty from the nursing schools to do the on-site training, which was a bit unusual for them to manage that way. And there's been a longer-term partnership that has taken place from there as well. Some of the other universities here, we partnered, as an example, Jackson State University. We had a whole partnership with historically Black colleges and universities around equity. Georgia Tech, we had a partnership for disabled communities. And our partnerships typically had health departments engaged as well. Next slide. So for the CDC Foundation, this just gives you an idea of the types. When we think about partnerships, we partner all the way from individuals to foundations, philanthropies, corporations. The business sector can play a critical role when it comes to partnerships. obviously other nonprofit organizations. And then we're here today to talk about the academic health departments. Educational institutions are very important, but other government agencies as well, which is quite important. If we go to the next slide, I wanted to give you, so I'm going to be a little rogue here and go beyond what the other speakers were talking about with academic health departments, because again, years ago, I learned about the strategic triangle, where when you want to get something done, particularly in government, you want to create public value, which is one apex of the triangle. You need to be able to operationalize and hit the ground running and make things happen, but you need resources. That's the third point on the triangle. And so in philanthropy, I think a lot about creative financing and partnerships. So this gives an example on this slide of some of our unique partnerships that we had during COVID. And I would encourage folks, when you think about the academic health department and these partnerships, may need funding to kickstart something. Certainly for long-term sustainability, government funding typically is the answer for the long term. But there can be really creative opportunities through partnerships. You already heard Paul mentioned Google and the partnership they had there. We also partnered with Google, and Google was one of the partners with Morehouse University. They came in both with funding and with technical support for an equity tracker that we developed with Morehouse University. Igloo is on here with cause marketing. So that's something the foundation had never done before. But Igloo, they were selling, folks were trying to go to the parks and try to get outdoors during the pandemic. And so with each Igloo that was sold, a portion of the proceeds came to the foundation for us to be able to do things like the partnership we did with the University of Washington or with Morehouse or others. The Talladega, I'll just call that one out. That one was a partnership where we went to the Speedway to help encourage folks, and we were there with the Alabama Health Department, with the president and all the folks at the Speedway, and it brought in a different audience to encourage them to be tested and be vaccinated, and that was an interesting day. I'd never gone around a track before in a pace car, but that was a lot of fun. And TikTok actually, I want to do a shout out to TikTok. TikTok actually gave us funding to be able to hire surge staff. What I don't know about this 3,200 field staff that we hired, the CDC Foundation field staff, what I can't tell you today, but we are doing a lot of analysis of this large hiring surge that we did during the pandemic. I don't know how many of those surge staff helped forge partnerships with academic institutions, but I can guarantee that they did, because we've heard a lot of stories of how the epidemiologists that we hired or the data analysts or some of the leadership positions were able to help advance the work. So I just encourage you to think outside. The Public Health Communications Collaborative on this slide was an opportunity for us to partner with the Beaumont Foundation and Trust for America's Health during kind of the height of the pandemic back in the summer of 2020, when there was a lot of need for support for communications for health departments. And the collaborative helped package materials, do webinars, and provide really easy to use information to the health departments to support their work. And the Health Action Alliance was aimed at businesses. So if we go to the next slide, the other thing we were able to do during the pandemic was to support community-based organizations. To date, or right now, I think we're supporting financially 249 community-based organizations across the country. And the word about this in terms of the workforce was, this was an opportunity for us to not just support them financially and help with vaccine confidence or things that were needed on the ground, but to help connect these CBOs to their health departments, but also to think about future workforce as we think about expanding and diversifying the public health workforce. Many of these folks working in the community-based organizations have now had a real introduction to public health. We've had webinars with CDC speakers and bringing in all the CBOs. And again, connecting them to the health departments, which has been a real pleasure for us to be able to do. And the last slide, and then we'll move to the Q&A. I love this quote from Peter Drucker, where he says that the best way to predict the future is to create the future. And I would encourage everyone to think, think broadly, think creatively, think about where those needs are, and then how might you use creative partnerships, and then particularly with the universities, if you're with the health department, or vice versa, make sure you're reaching out and talking to those partners. So with that, I'll stop my remarks, and Ron, I think I turn back to you and Kathleen.
Perfect. Thank you so much, Judy. And let me invite all of our panelists to come back on screen. I should also mention that we're joined today by Bill Keck. Dr. Keck is the chair of the Council on Linkages and also has a great deal of expertise in academic health department partnerships. We have heard incredible presentations. Thank you all so much. We've heard how academic partnerships have been contributing to capacity building, career training and career tracks, direct service delivery, data collection and analysis, additional partnerships beyond the academic health department, sustainability of AHDs and other programs, and we've heard a whole lot of creativity that these AHD partnerships have contributed to as well. And of course, we have fine leaders with us here today who've contributed to all of this. And thank you again for those presentations. I'm going to just start us off with a question. And please, everybody, put in your questions in the chat box. And I've seen a couple there. And I know, Kathleen, you're monitoring that as well. So the question I want to start off with is, throughout the pandemic, as your experiences have highlighted, we have seen existing partnerships expanded and new ones created. What have we learned about these partnerships throughout the pandemic that may help us sustain and expand them moving forward? And let me, I guess, I didn't tell you guys which one I would start with. And Tanya, we'll start with you since you've been quiet a little bit now. What with the other presentations?
Sure. Thank you, Ron. Yeah. So certainly our partnerships with academia have grown. I mentioned one of the areas that it has grown. We were able to provide a letter of support to one of our academic partners as they wanted to work on a public health informatics grant. And this will not only end up benefiting the local public health, but also the state Department of Public Health in Massachusetts, and actually perhaps everybody, because my understanding is that the educational materials that they're developing will be available broadly and widely. They're obviously integrating it into their public health curricula, which will strengthen the UMass Lowell public health curricula around informatics, which, if we all have learned anything during a pandemic, it's how to visually display data that the public can understand as a critical skill. So really excited to continue to develop that relationship. My colleagues who work with our population health information tool have provided job descriptions for the positions that for the data analysis and visualization. And so the school is taking these descriptors and incorporating them into some of their coursework, which again will only strengthen our future public health workforce. So that's just one.
Sorry, I left myself muted, but nobody had to tell me this time. Let me ask Paul if you would like to add to that from your experience.
Sure. Thank you, Ron. It's an important question, and one that I would say that our best way of creating that future that Dr. Monroe was describing is to do the best job that we can with the partnership activities today, and let them speak for themselves in terms of the future likelihood. I think when when both partners, both the academicians and the practitioners mutually benefit from the engagement, that in and of itself will often drive future involvement and future opportunities.
Great. And Judy, anything that you'd like to add?
Yeah, I'm going to give you a twist on partnerships, and something that we've been thinking a lot about recently and that we were actively involved in. And that's bringing the arts and cultural organizations into public health. And an example of that, we've actually just funded 30 organizations across the United States to do this. And some of those organizations in their proposals to us are going to be doing like theatrical experiences or having skits or having improv. And they're going to include local folks from academia or clinicians and public health leaders, along with the actors and the workers. And I'm particularly excited about it because we need to build trust. I mean, that's been fundamentally a huge problem throughout the pandemic, is trust. But it also gives this creative outlet that in the eyes of, if you think about mobilizing additional resources, whether that's through your legislators or whether that's through philanthropy, having a little fun and doing things creatively together actually can go a long ways, I think, with building that type of support.
Great. And I saw a question pop up earlier that asked about how you track and monitor these programs and what constitutes success. Paul, I'm going to turn first to you because I know you've been doing research in this area.
Well, one way that that we have tracked activities in the past is to use a logic model, that has allowed us to really clearly visualize and more easily categorize the various inputs, the outputs, the outcomes of the activities. And we use that logic model sort of tracking and reporting framework as a basis for making decisions about future activities. So that's a manageable way to track things.
Great. And Tali, Antanya, Judy. Well, Judy, I also know you do a lot of evaluation at the CDC Foundation. So maybe you'll weigh in, and then Tali.
Yeah, so I'm going to jump in here because I mean, sometimes to get the rest of the story and to know the full impact can take a little time, right? And so we actually have a board meeting this week, and we're going to be reporting out to the board what we did during Zika. We had a project in Puerto Rico called the Zika Contraception Access Network to help prevent the horrible birth defects. So here we are, 6 years later, and I'm blown away by the evaluation that's been done. We have everything from the number of women served, but also they've been able to extrapolate, and we know the number of birth defects that this project was able to prevent. And in addition to that, we've got economic analysis, and we know how cost effective the project was. In addition, there are a number of other metrics, but those are some of the high level ones. And so, yeah, it's always fun to work with CDC because they are obviously very determined about metrics and evaluation. So, and
it's so difficult to get those short-term demonstrations, which is where the logic model becomes very, very useful. Tali and Tanya, anything you want to add?
So I was just going to add for Massachusetts and the interns who work specifically with the state health department, we have a database of everyone that has participated in an internship. We have a very nice set of protocols for obtaining the information, making sure we know emergency contacts. As I was looking at that information recently, I'm like, oh, we actually don't ask race and ethnicity. And so as we are looking ahead and we know we want to diversify our workforce, we're not going to know if we do it unless we ask. So using my own advice from our racial equity data roadmap, is you must look at race and ethnicity, gender identity, where are people coming from? And also one thing that we do currently is exit interviews. We conduct exit interviews with interns who are leaving to understand, what their major takeaways from their experience were, what they wish they'd had the opportunity to do, and also what their next steps are. So we can begin to start pulling that information together. I don't have a big, robust report about it, but we haven't had the staffing. This is an add-on to the great work that we already do, but as a start.
Great, thank you so much. And Kathleen, I'm going to throw one at you for a moment, and Bill Keck. There was a question about a data bank on best practices, experiences, and our models from the academic health departments. Is anything like that available?
It's a great question. So we don't really have a data bank per se. What we do have are a lot of things like this. So we regularly invite organizations to share what they're working on, their AHD partnerships through events like this. And we record all of these, and you can find all of them. We can drop the link into the chat box of where those live, all the recordings highlighting different partnerships that are occurring across the country. We do have a page on our website where we list academic health departments, and to the extent that those partnerships are putting resources out, talking about their AHD partnerships online, we have links to where those websites are with additional resources. And we're kind of building out a collection of resources that will or can help organizations in developing partnerships. So we have things like examples of the sort of partnership agreements that organizations put in place to formalize their partnership. And then we've done various things over the years. We had an advice column for a while through our blog where Bill provided guidance to organizations. People could send in their questions. And so there's a lot of information in resources like that that have kind of tips or tricks or promising best practices for how you might go about building this work. I don't know, Bill, if there's anything you want to add to that, or Ron, you might add to that as well.
Well, yes, we might add that we have a bunch of previous AHD webinars that are stored. That can also find those online. So there are a variety of examples from small and large health departments and a variety of different kinds of partnerships that have been highlighted that might be instructive to folks. But there is no official list of academic health departments. I guess our learning community is the only sort of club we have at this point. But we've been delighted over the years to learn from folks like our panelists who have been active in this area. And we hope more of you on the call will become active.
Yeah, and that's a great, oh, sorry, go ahead.
Yeah, I was gonna say, come join the learning community.
Yeah, so that is another great resource. It's not like, out on our website that you can just click on it, but we do host this learning community that Ron mentioned at the beginning, our academic health department learning community under the umbrella of the Council on Linkages between academia and public health practice. And that community, it's a peer learning community, has about 1,100 members from all across the country. I think there's people from every state working in health departments and academic institutions and nonprofits and other types of organizations. So that community can be a great resource too. There's a listserv, so you can ask questions and things like that. So if anyone is not part of that and would like to get involved, feel free to just drop me a note in the chat or send me an email or whatever, we can hook you up.
Right. We also take lots of individual questions that people email Kathleen all the time, and we try to connect people with others if we can't answer the question. So I saw another question in the chat box that had to do with funding. That funding often is a barrier to establishing these partnerships. And I'm pretty sure we heard from each of you that you've overcome that to some degree, or you've been creative in figuring out a way to bring funds into this. And maybe you could talk a little bit more about how you went about that, how you were successful in getting some funding for these partnerships that you're so involved with. And I'll just throw it out there for whoever would like to chime in initially.
Ron, I'm happy to attempt to answer this, at least from our perspective in Massachusetts. I will say our director of our state laboratory, about a year and a half before the pandemic, said, I'd really like us to create a program where we pair local public health with public health students, and they learn our investigative disease surveillance system, how to use it, how to do communicable disease investigation and contact tracing. And so I have to say, having her as a champion for the academic health department and its continued support and growth has been incredibly important. People have a lot of faith in our state laboratory for what it's been able to do, especially during the pandemic. I just want to give a huge shout out to all my colleagues, all the epidemiologists and field staff and laboratorians who made it through successfully, an incredible couple of years. So having that has been incredibly important. With that said, her bureau director, who really oversees where the funding goes from grants that they receive, saw that this academic public health core was an incredible, important pipeline for the workforce. And so through the laboratory supplemental grant funding is where we were able to allocate some of those funds explicitly for the academic public health core. So we know that's only for 2 years. And so we will need to figure out what happens after that. And we are not short-sighted about that looming deadline. So are actively in collaboration with our colleagues at the Massachusetts Health Officers Association. So seek those partners, seek those collaborators. So at least for that initial funding has been incredibly important.
Judy, I know you're out there fundraising a lot to do, I guess looks like over $1 billion worth of work with during COVID. You brought in funds, but so any advice that you have?
Yeah, so I mean, I think you need to tease it apart, right? So again, I'm with a foundation, and we go out and rally philanthropic and private sector funding. So that's one avenue, and you've got local. You do have local philanthropists, and you have local foundations that may be very interested in what you're trying to achieve. But the other is the federal funding that's flowing right now, or is about to flow. There's going to be another $3 billion released, sometime soon for workforce, and how that gets, managed at each state, local level will be obviously up to jurisdictions within the parameters that the federal funding has. One thing I'll just do a shout out about, if folks want to learn more about both funding and workforce, we've done a series of summits, Lights, Camera, Action, the future of public health. They're online. You can see the entire workforce recording, and you can see a written report. Patty Simone is recorded giving a really nice synopsis of where CDC is going with new workforce funding. And then last week we did one on public health governance, public health law and finance, and it talks about some of the issues around financing. So there are resources out there.
Great, thank you, Judy. And Paul, I see your hand up.
Sure. Yeah. Thanks, Ron. Just real quickly, there are lots of different models that are out there for how to make the partnership work. I found that in my experience, being able to identify a person to help coordinate those partnership activities was really key. When I was in Tennessee, we were able to do that by having a true joint appointed person, Julie Grubaugh, who worked both at the health department and in the academic setting, half-time in each place, and each of us funded half of her position. Obviously, that requires some money. One of the most creative ways that I've seen this happen was at the East Tennessee State University, where they involved DRPH students who were needing to do a practicum and having their practicum period serve as the academic health department coordinator between the academic setting and the practice setting. So lots of different ways to do it without involving a lot of exchange of actual monies.
Great. Dr. Keck.
Well, I was going to mention something that Paul just finished his comments with. That is, you can often, if you're careful and thoughtful, use existing resources just by reallocating them or getting into a sharing relationship with your partner or various partners. That's not always possible, of course, but it is possible in a number of circumstances that you can rethink and reorient opportunities you have within your own budget to combine with someone else, like shared personnel, for example.
Great. Well, I see that we are winding down in time, so I'd like to turn to our panelists one final time and see if in 1 minute or less you have any last words or advice that you could share or tips that you could share. And gosh, I'll start with Tanya.
All right. I would say participate in events like this. I was just private chatting Kathleen in the background about Julie, actually from the University of Tennessee, who was instrumental in talking with us back in 2015, 2016, when we didn't have any clue what we were doing. And our aspiration is to that model where we have that joint opportunity for a person who straddles both public health and an academic organization. Patience and develop relationships. Find that shared result that you're all working towards and communicate well around it. So even in the very beginning stages, if you do all of those things, success will be yours.
Great. Tali, is there anything you'd like to add?
Oh, thank you. I cede my time to the other panelists. Thanks.
Okay. Paul, I'll turn to you.
Sure. Thank you, Ron. And again, thanks to the Public Health Foundation for your sponsorship of this. 2 or 3 things real quickly. From the outset, focus on it being mutually beneficial. Again, I can't stress that enough. Identify someone whose work is to help coordinate the activities so that it doesn't get lost between the partners. And I'm easily locatable on our website. Feel free to drop me a line if I can help provide any guidance to any of you on the webinar in any way. Give me a yell.
Great. And Judy.
I couldn't agree more with the other speakers. So the thing I will add to what they've said is it's the old adage that opportunity favors the prepared mind. I cannot tell you how many times in my public health career that I've had a notion, or our team has had a notion, we've had a vision for something we wanted to get done. And somehow in the next week or two, I'd be sitting at a dinner table, or back in the days when we were in person, and boom, there was the opportunity. There was the partner right in front of me. So make sure you have your vision, think it through. What is it that you aspire to do? And then, as the others have said, make sure that you're building relationships, talking with people, paying attention to where those opportunities might come, and make sure you end up with a win-win. Everybody needs to gain in the partnership.
Great. And Kathleen, I'm going to turn to you, since I know that there are some resources too that we've added to the slide deck.
Yeah, I agree with everything that everyone has said. And I guess I would just add, reach out. Like, even if it seems like the stupidest question on earth, don't be afraid to ask the question. Like, everyone has been there, everyone's gone through it, everyone's jumped over those hurdles and figured out a way through. So just reach out. And on that note, we do have a number of resources. If you download the slides, I know Abdullah just put the link back in the chat box again, but if you grab the slides, there are resources, links to resources there, as well as contact information if you'd like to get in touch with us. Ron, back to you.
Great. And thank you to all of our panelists for wonderful presentations and discussion. And thank you to all of our participants for engaging in this conversation. Hope everybody has a great rest of your day.
Ron, one final thing. If anyone wants to join the learning community, they should just send Kathleen an email. Doesn't cost anything.
Good point.
We welcome everyone. So please join us and take advantage of the relationships that are there.
Absolutely. Thank you.